Katie, what stood out to you, first of all, from what you saw from the debate?
Well, really, it was Rustad and Eby attacking each other.
And they, saved their most sharp attacks for each other, while Sonia Furstenau, she did attack both of them, but kind of almost put them in the same category, saying that they are portraying sort of a status quo where she says the Greens are the only party that has a long-term vision. And it was interesting because one moment was where Sonia Furstenau said that Rustad's vision of BC is one that is of doom and gloom. Now, Rustad said that he portrays that because of the last 7 years under the NDP have been tough for people. He cited the healthcare crisis, housing, the opioid crisis. And there was one moment where he actually portrayed it, or he shared an anecdote from walking down the street in Vancouver and as an evidence of how bad the opioid crisis is. And here's what Rustad said.
I was on my way over here, and at the corner of Robson and Hornby, there was an individual who died. And there was emergency people rushing. This person died from an overdose. This is the British Columbia that David Eby has created. Tent cities are growing all over the place. We have a crisis in healthcare. We've got a crisis in affordability. We've got a crisis in housing. What we need is a common sense plan that is going to be able to deliver for people in this province.
So, Katie, what did we hear from David Eby on, for example, overdose deaths, poison drug deaths?
Well, David Eby basically defended his government's approach, but he did say they had to pivot on decriminalization. He admitted that, but said that that's an evidence that the government is listening and is adapting. He touted his government's or his party's plan on involuntary care, which he says is compassionate care, and he portrayed Rustad as not having a firm position. He called out Rustad for first promising to close what Rustad had called drug dens, that's safe consumption sites. Then Eby attacked him over changing his position and then saying they would be open under a different name. He's basically saying people don't know where you stand, and here's a bit of what Eby said on that.
I think it's critically important on an issue as challenging as the toxic drug crisis to be frank with British Columbians. We're going to have to try different things. We're going to have to do different things to get at this and provide people the support that they need. And it's not okay to play politics with it, John. It's not okay to say to one community when you're in Richmond, to the Chinese community, we're going to close the overdose prevention sites. We're going to close them, the drug dens, you called them. And then later on, you say, well, actually, we're not going to close them. We're just going to change the name. And then your critic, Eleanor Sturko, comes out and she says, well, actually, we're going to expand them. We're going to put additional services. People need to know what the plan is. These are hard issues. Lives are on the line. This is not a simple fix. It's not solved with a tweet, and it's sure not solved by pretending to one community instead of addressing it head on.
Katie, we also heard a debate about vaccines and perceptions that John Rustad is anti-vax, and he did address that. What did we hear from there?
Well, so both Eby and Sonia Furstenau were criticizing Rustad for his statements on social media or in a leaked video that he regrets getting the vaccine. Eby said...
The COVID vaccine, we should clear.
The COVID vaccine, of course. And Eby said that some of his candidates have donated to the Freedom Convoy, and those are protesters who've been protesting outside of hospitals. Rustad says he's not anti-vax, he's anti-mandate, so trying to separate the two and basically saying that it's under, Dr. Bonnie Henry that we saw the sidelining of healthcare workers who are critical to our system. So there was a spicy exchange about that the viewers can see.
We were all rolling up our sleeves to get vaccines to protect vulnerable seniors from COVID-19. When Bonnie Henry was working night and day to keep us safe during the pandemic, John Rustad and his candidates were providing donations to people who were protesting outside of hospitals, anti-vax convoy members. He's still an anti-vaxxer. He appeared in front of a group of people that called the so-called, you called it the so-called COVID vaccine. You said you wish you'd never been vaccinated.
That's just not true.
And then when someone said, do you think that public health professionals should be tried like Nazi war criminals? You said, well, we wouldn't do that in BC, but we would support an international effort to do that, John. It's embarrassing. I wouldn't fire Bonnie Henry. I'm trying to hire you and your family a family doctor. We've connected 250,000 people to family doctors. We've got so much more to do. But if you think that we'll be safer in our province with someone who doesn't believe that vaccines work in charge of things?
Thank you very much, Sachi. The reality is I'm triple vaccinated. The reality is, in British Columbia, I also promoted and supported people getting vaccinated, especially for seniors in our communities. I was supportive of that. However, I am not anti-vax. I am anti-mandate. I believe that people should have choice. It shouldn't be thrust upon them and forced upon them or coerced to be able to take a vaccine.
You never know which John Rustad's going to show up.